Professor, the potassium is only 2.4. Should we replace it?
Yes, but replacing potassium is easy. Finding out why is what makes you a doctor.
What symptoms should make us suspect hypokalemia?
Think muscle weakness, muscle cramps, and cardiac arrhythmias.
Professor, should we check an ECG in every patient with hypokalemia?
Absolutely, can cause flattened T waves, ST segment depression, prominent U waves, and a prolonged QU interval. The ECG tells us this hypo, but every abnormal potassium level has a story.
So our next step is to find out why the potassium is low. Can poor dietary intake alone cause hypokalemia?
Rarely. Healthy kidneys hold on to potassium. Most patients have another cause in addition to poor intake. Shift into cells.
Gastrointestinal potassium loss, renal potassium loss.
Excellent. Every cause of hypokalemia fits into one of these three mechanisms.
So the body didn't lose potassium?
The potassium is still in the body. It has simply shifted into the cells.
The body didn't lose potassium. Why is the blood potassium low? Because the potassium shifted from the bloodstream into the cells.
The total body potassium is unchanged, but the serum potassium falls.
What makes potassium shift into the cells?
Let's look at each cause, one at a time.
So insulin lowers potassium by moving it into cells?
Exactly. Insulin activates the sodium-potassium pump, shifting potassium into cells without reducing total body potassium.
So B2 agonists lower potassium the same way?
They stimulate the sodium-potassium pump, shifting potassium into cells.
Why does alkalosis lower potassium?
As hydrogen leaves the cells, potassium moves in to maintain electrical neutrality.
So thyroid hormone can also shift potassium into cells?
Activates the sodium-potassium pump, causing hypokalemia and periodic paralysis.
So the body didn't actually lose potassium.
Now let's look at conditions where the body truly loses potassium.
So this time the body is actually losing potassium.
Correct. Unlike redistribution, gastrointestinal losses reduce the total body potassium.
So diarrhea causes both hypokalemia and metabolic acidosis?
Exactly. The body loses both potassium and bicarbonate.
So potassium can also be lost through the kidneys?
Exactly. The kidneys are the other major route of potassium loss.
Professor, what's the next test?
Measure the urine potassium. Low means the kidneys are holding on to potassium. High means the kidneys are losing it.
Professor, urine potassium seems helpful. Why do many physicians use the urine potassium to creatinine ratio instead?
Excellent question.
Why isn't urine potassium alone enough?
Because urine concentration changes the potassium value. Luna, look at these two different samples. Both have the exact same amount of potassium. By adding creatinine, we get the ratio. Now both samples show 13. This corrects for the concentration.
So the ratio corrects for urine concentration?
It gives a more reliable estimate of potassium excretion. For simplicity, we'll simply say urine potassium throughout this lesson.
So measuring urine potassium tells us whether the kidneys are wasting potassium?
Exactly. It's one of the most useful tests.
Professor, what's the next clue after urine potassium?
The acid-base status. It quickly narrows the cause of hypokalemia.
So metabolic acidosis with hypokalemia suggests either diarrhea or renal tubular acidosis. So metabolic alkalosis usually points toward renal potassium wasting or vomiting.
Helps narrow the cause of hypokalemia before you even make the diagnosis.
So after confirming renal potassium loss, blood pressure helps narrow the diagnosis?
Blood pressure is one of the most useful clinical clues.
So high blood pressure suggests excess aldosterone?
Aldosterone retains sodium and water, raising blood pressure while increasing potassium excretion.
Then we measure renin?
High renin points to secondary hyperaldosteronism. Low renin suggests primary hyperaldosteronism.
So the kidney is driving the aldosterone?
Exactly. High renin stimulates aldosterone, Rethic, leading to potassium loss.
Professor, why is the renin low?
In primary hyperaldosteronism, excess aldosterone raises blood pressure and blood volume. The kidney senses this and suppresses renin.
If the blood pressure is normal, what's the most common cause?
Always ask about diuretics first.
Why do diuretics lower potassium?
They deliver more sodium to the collecting duct, causing the kidneys to excrete more potassium.
We're replacing potassium. Why isn't it increasing?
Without magnesium, the kidneys continue wasting potassium. Luna, can you summarize the step-by-step approach to finding the cause of hypokalemia?
First, determine whether potassium shifted into the cells or was truly lost. If it was lost, decide whether the loss is gastrointestinal or renal. Then measure urine potassium. Use the acid-base status, blood pressure, and renin-aldosterone levels to identify the cause.